Everybody, we are live. Welcome to tonight's live cast. Welcome, everybody. I hope you are doing well, and I want to welcome you to tonight's live stream. We are back with the live streams. It feels good to be back here live again. Hope everybody is doing well as you're coming in here. And make sure that everyone knows what is going on. Who do we have on the live cast right now? We are live, ladies and gentlemen. We are back with the live casts. We got Emily on this live. We have Tamis in the live. People are coming in. Come on in. Come on in. Come on in. I hope everyone is doing well. As you're coming in, we're on Facebook Live as well. We are on YouTube Live as well. We have Larry, Courtney, we have Tamis, we have Emily. So everyone, as you're coming on here, give me that hashtag, let's go. Give me a hashtag, let's go, down below, whether you're watching on Facebook or you're watching on YouTube. We have, I hope I get your name right here. We have D. Leon Ina in the house. We got Robert. We have Andrea. We have Adam. We have Tamis. What's going on? Tamis says, I still want that Lippman. Well, my friends, make sure you tag a classmate in this live because we've got a lot of updates going on, some teaching as well. We have some big updates. I'm just waiting for everyone to come on into the live. Once we get a few people in here, we will get the live stream going, okay? Let's do some shout-outs while we're getting this party started, right? We got Adam. We got Tamis, Cynthia, Tamis again. We have D. Leon Ina. We have Tony. Tony says, what's up, man? Tony, what's going on? We have Shauna Lynn. Shauna Lynn, how are you? So, guys, let's get this party started. Here we go. Now, what we're going to be talking about tonight on this live stream here is very simple, okay? I'm going to be going over the exact mnemonics that helped me out tremendously. When I was going through my clinical time, when I was first starting to work up patients, and I want to give these mnemonics to you. I know a lot of people here right now that are probably new. You guys are probably new. Maybe you're unsure. I want to give you these mnemonics, and they have to do with a lot of different patients. Chest pain, shortness of breath, altered mental status, and we're going to go over and more, even respiratory. I'm going to give you these mnemonics here tonight. Now, first, I got a few updates. If you are not on the Paramedic Coach YouTube channel, go there now. You can go there now, after the live, whatever you want. I made a big change. On the front page of my YouTube, it is now all nice and organized. So everyone has their own section. You'll see EMT section, a paramedic section, people that are thinking about the career in EMS. It's all organized, and they're organized into playlists, okay? I also have a section for student success. And the bottom is all the past live streams. So make sure, all you got to do is type in The Paramedic Coach into YouTube to be on the YouTube channel. Some more shout-outs, Tony, Tamis, Rob, what's up? Christopher, hope you guys are doing well, guys. Now, that's update number 1. Update number 2, I'm going to give to you right now, is this. Update number 2. We are going to be holding the largest giveaway in our history, my friends. The largest giveaway in our history is going to be going on very, very shortly. So I hope you're ready for it, okay? Now, I was ready to go. As you can see, I want to announce it right now, but I can't. Because I have to have the products in my hands, and they're not here yet. I'm waiting for the mailman to come and bring them. So I just want you to know one thing, and one thing only. It will be the largest giveaway, and I'm going to give you a little teaser, my friends, on this giveaway that we're going to do next across all our platforms. Guys, I'm on every platform, TikTok, Instagram, Facebook, YouTube. We're all there. Daily content almost every day on TikTok, Instagram, Facebook, and I have a few more updates about YouTube I want to give to you, so stand by, okay? Then we're going to get into the whiteboard, okay? Now, the next thing with this giveaway that I want to share with you I'll give you a little teaser. Okay, give me a hashtag giveaway. Give me a hashtag giveaway in the comments right now. And I need 5 people right now to step up and share this live. And I will give you that little teaser right now. I need 5 people to step up, share this live stream right now, and give me a hashtag giveaway in the comments. Everybody right now, hashtag giveaway. And I'm going to give you a teaser on what's going on. Okay, hashtag giveaway, hashtag giveaway, hashtag giveaway. Tony's doing EMT ride time as we speak. So I'm helping a lot. Tony, thank you. Tamisha's like, let's go, everybody. Holly Lee, hashtag giveaway, hashtag giveaway, hashtag giveaway. We got Matt, Holly, Whitney, Sean. I don't want to miss anybody here. Matt, Stefan, Lori, Beth, Rachel, Cynthia, Holly Lee. Okay, beautiful. Hey, Zachary's in the house. What's up? Zach, what's up? So, Matt, what's up, Matt? We got we got one more. Gotta shout somebody else out. Larry, and we have Laurel Mar. I think it's Mares or Mars. Hope I got it right. What's going on? So that should do the justice. Here it is, my friends. Our next giveaway is going to be multiple winners. In fact, we're going to have three different winners: a first place, a second place, and a third place winner in our next giveaway. It's going to be the largest giveaway in our history. Now, what is it going to be? Stay tuned. Stay tuned to my page. I'll be doing more lives. I want you to know something. A few updates I want to tell you about YouTube and a few other things. Update number one. Update number one is I'm going to be doing a lot more live streams. Some may be teaching. Some might be me literally just sitting in front of the whiteboard talking to you about a topic. I got something I want to share. I want to get it off on a live stream so I can deliver that to you. So sometimes there'll be a full lesson with a whiteboard. No, I might just go live and say, hey, what's going on? I just talk to you guys a little bit. Maybe a little Q&A, chop it up about school, right? Stay tuned to my Instagram for quick lives as well, and TikTok, Facebook, YouTube, all those platforms. Facebook, YouTube, if you're not aware, is usually more of a teaching live. Instagram and TikTok would be more of a live of me just kind of checking in with you, okay? Now, a few more things that I want to go over. YouTube, massive overhaul. I talked about the front page. I made all these, I made 4 actually, but 3 main ones of playlists on the front page. I already went over that earlier. So go to my YouTube, type in the Paramedic Coach. You'll see the beautiful playlist. Go watch those playlists. The content there is some of my really best stuff on YouTube. Hope you enjoy it. I put a lot of work into the YouTube to make them crisp for you guys. The last thing is my YouTube. We had that big giveaway, obviously, went on last month. So we had a little bit of a lull. That was a big event we had. With more lives comes more YouTube videos. I have a whole archive of YouTube videos that I'm about to put out. Is coming out very soon. So stay tuned for the next YouTube videos. I have a huge video coming out, my friends. Huge video coming out Sunday night. I think this is going to be a groundbreaking video. I haven't seen another video go this deep on burn, no pun intended, on burn emergencies and the rule of 9s. Okay? I really haven't. The rule of 9s is something that so many people struggle with, and I guarantee you right now, there's probably even some advanced providers that go, man, that might say that they're weak on the rule of 9s. I know when I first went myself to paramedic school, I still wasn't strong in the rule of 9s. It takes a long time to get that ingrained in your head. So that video is going to be very impactful. I go over, using this whiteboard, every single thing I know about burn emergencies that you need to know for the exam and out in the streets. That video is on YouTube. Invite a friend. It's a premiere, a YouTube premiere. Sunday, it's going to be 8:30 Eastern on my YouTube channel, okay? And now that I get all that off my chest, because I haven't gone live in a few weeks, man, it feels good to be back live. I am so happy to be back here with you guys, really. Going to be doing way more of these live streams, so don't worry. I'm going to give you my all tonight. I got one ask of you guys. invite a friend. If you love what I'm about to share with you tonight, invite a friend and just share this live. Tag a friend. Tell a classmate about the Paramedic Coach. Because the next few weeks, get ready for the ride. There's going to be a lot of lives. So here we go. Tonight, we're going to be talking about my friends. And a few more shout-outs before we get going. Rayanne, Zach, Rob, Zach. And then I hope I get this name right. Let me just see. I just keep one coming up. Keandra. There it is. Boom. Got it. I think I got it. Awesome. Keandra, I know you've been around for a while. Hope you're doing well. Also, my friend. Let's dive in to tonight's topic. Here we go. So what we're going to be talking about tonight is the best mnemonics that I use to work up patients. So can I show you something real quick? It's so important. And no one talks about this, so I'm going to talk about it here tonight. And here's what it is. When you go up to a patient, okay, there's a big difference between thinking critically about patient care and having, like, some may say a cookbook medic, right? So we want to go and approach the patient with a little bit of a checklist approach. We have to check for some things, but we don't want to be what they call a cookbook EMT, or if I say medic, I mean EMS provider. I just happen to say medic, okay? Both applies. So we don't want to be totally like we're reading a recipe. Okay, check. No, we don't do that. We got to use our brain. But we also need to have a good standard approach when we're first starting. So when you're in school, things like sample, OPQRST, right? Those give you a good standard to say, okay, those are fair questions to ask a patient. So what I'm going to talk about with these mnemonics here is some of these I've gotten from my mentor, okay? I had a great mentor in the education space, John Belinsky Jr., who's a PA. Was out in New York. I think he's down in Florida now. Awesome provider. Also has a YouTube channel. Incredible. Some of these mnemonics tonight are from him. Some of these mnemonics tonight, I actually took an inspiration from him, and some are my own that I've created myself. The reason I bring up some of these mnemonics is for this reason, and I'll tell you why. I remember the moments when I was going through ride time, and the preceptor would ask me, hey, we're at an altered mental. What are you thinking? We're at chest pain. What are you thinking about? We're at a shortness of breath patient. What are you thinking about, right? Well, in those moments, I was sharp. The only reason I was sharp were these mnemonics, and I'm going to share them with you now. First, when you approach an altered mental status patient, you need to have some sort of checklist in your brain on what you're going to do. So I'm giving you exactly what I do to this day. Let's go over it. Hey, if you're new here, welcome to the Paramedic Coach. Now that we got those updates out of the way, let's do it. We have about 44 people on the live here between Facebook, YouTube. Pretty cool. Let's dive into it. Cynthia's saying she can't hear me. Before we get started, let me make sure we're good here. Can you guys hear me okay before I start the lecture? Somebody give me in the comments, can you guys hear me okay? Because Cynthia's saying she can't hear me. Can you guys hear me? Somebody say, yes, I can hear you. I need a yes from somebody. I see comments. I see stuff. Yes. Okay, thank you, guys. All right. First mnemonic we're going to go over. Thank you, guys. First mnemonic we're going over is altered mental status. Here we go. Okay. So here's what I want you to think about from now on. You're doing clinical. You're doing ride time. You're doing anything involving patient care. You're out on the road right now as an EMT, advanced EMT, paramedic. If you show up and you find out your patient is altered, I want you to hit them with the 4 S's. I want you to think first, okay, and what these mnemonics do, by the way, it's almost like, how can I say this? It's almost like cheating critical thinking, if you will. It's almost like taking the easy road of critical thinking, but it's right here when you need it. That's the way I think about it. It just makes the process so much easier. That makes sense. It's like a cheat sheet. That's the best way to put it. So there's 4 S's in altered mental status. This mnemonic is my own. There's 4 S's in altered mental status. So what are we going to do first? Okay, let's say we go to a 68-year-old male patient who is altered, not acting right, sitting in a chair, GCS is 13, confused, okay, so we lose a point, not obeying commands, so we lose another point. But the eye opening is spontaneous, so let's say it's GCS of 13, okay? Confused, not A-no, okay? Alert, but not disoriented, okay? We're going to hit that patient with the 4 S's. S number 1 is blood sugar, okay? So anyone who's altered, you take a blood sugar. Now, what's number 2? Well, number 2 is stroke, because I want this sentence to resonate with you. No stroke is a stroke until we check a blood sugar, which is why blood sugar is first. So if I walk up at a gentleman, I'm going to introduce myself, go through my steps, and then I'm going to check it, have my partner or myself get a blood sugar, and then I'm going to do, then I'm going to do a fast exam. Face, right? We have to check for the facial droop, okay? Arm drift, okay? What we do next? Speech. Is there no speech, or is the speech slurred? And T is time. Everyone forgets T is time. Okay, that's our stroke scale. Now, with our stroke scale, the fast exam is the exam that we do. So we check for the facial droop, we check for the arm drift, we check for the speech, and the time stands for the time they were last seen normal. That's what we're looking for. When was the last time someone here on the scene saw this person normal? Okay. So now we've done that. So let's go back to our 68-year-old male patient. Let's say we got a blood sugar. So here's how you use it. Let's say we get a blood sugar and it comes back at 84. Normal, is that in the comments? Let me know. Is 84 normal or abnormal for the textbook? Give me for the textbooks. Let's say this wasn't a diabetic. Is this normal or abnormal? 84. It's normal. Okay. So we know, okay, not a blood sugar problem. Let's say I do a stroke scale and it comes back negative. Okay, they're not having a stroke probably. Okay, where do we go from here? There's 2 more S's you got to do. The next one is going to be sepsis, okay? And then I'm going to give you the last one here in a sec is seizure. Now, how do we check for these things? Well, I want you to know something, that sepsis, most commonly, you'll see in your patients, is caused by a few things. Pneumonia, very common. UTI, very common. Now, are there other things that could cause sepsis? Hell yeah. Okay. A sneaky one that you want to think about, I always throw it out there, is someone that has abdominal pain. Something could be a bleed, something leaking in there into the peritoneum, and that's going to cause the abdominal lining, and that's good. What is that going to cause? Sepsis. Something to think about with an altered mental. I like to throw it out there. Okay. Now, seizures is very simple. Do they have a seizure history? Do they have a history of seizures? Some medications, Keppra, Dilantin, Lamictal. Those are some of the most common seizure medications someone takes pills for at home. Okay. Now, this is how I give my scenario with altered mental status. Okay, here it is. And by the way, we're going to be here for a while, so get the popcorn and get ready for the ride. Okay. Now look. Let's say we do sepsis. We don't see any signs of pneumonia. We don't see any green yellow sputum. We don't see any fever. They're not tachycardic, but they're still altered. So maybe we're not thinking, well, it doesn't look like sepsis. So we go to seizures. There's no seizure history. They didn't bite their tongue. They're not combative. They're not acting post-ictal. Well, damn, these are all negative. What do we do? These are some of the most obvious things that we cannot miss. If you show up in the ER and someone has a clear-cut stroke or the blood sugar is too low or extremely high, you're going to look very foolish. You're with me? All these things. We got to examine. So this is why I do these first. Now, what would you do next? Oh, okay. We don't just stop assessing the patient, right? Yes, we're going to get them on the stretcher, transport them. Yeah. I get all that. I'm saying, what do we do next? I'm going to give it to you. So now here are the S's. You have them here. Okay, you can watch the replay of this, by the way, but I have to erase this. Sugar, stroke, sepsis, and seizure. Okay? So let's now, me teaching you this, it gets lengthy, right? Me teaching you this, it can go on and on and on. I'm giving you different scenarios. In real life, that takes 2 minutes. In real life, the 4 S's take 2 minutes. Check a blood sugar, do a stroke scale, check for signs of sepsis, the most common routes, and then what do? Check a med list for any seizure activity, open your mouth. Done. That's it. And he said the head trauma. Oh, we're getting there. See? We're getting there. See? We're getting there. Okay? Now hear me out. If it is not, and this part of the mnemonic was influenced by my good friend John Belinsky, who I did an interview with on this channel. And this is what I used. It's NOT, not. Now, he has a version for PAs. I've tweaked that mnemonic for EMS. And let me show you how I look at the mnemonic. It's a little different, okay? But I did get some influence off that from John. I'll show you here. So it's NOT. NOT. So the mnemonic that I have is if it's not one of the 4 S's, okay, we hit them with NOT. So now what do we look for? Well, N stands for Narcan. When I think, okay, close your eyes right now, I say Narcan, what do you think about? Overdose. What kind of overdose? An opiate overdose. But don't you kind of still think about, when I say Narcan, you say the word overdose in your head, right? So when I say Narcan here, I'm thinking about, are we at an overdose, whether it's accidental or on purpose, of anything, okay? That's why we have the N. So basically what I'm saying here is this patient showing signs of a sneaky overdose. Like, for example, do they have respiratory depression and hypotension and bradycardia and they're altered? That would be right here, right? With me? Okay. Now, what's the O? O is very simple, my friends. Right here, your pulse ox, your O2. So if you are hypoxic, then you are going to be altered mental, okay? And finally is T. Now this is where I changed it a little bit, and we go, T is for trauma. So I talked about it earlier. T is for head trauma, okay? Now I'm going to show you an example of how we would do this in real life, right? So we have a 68, I'll do it right here on the camera, okay? So let's say we have here a 68-year-old male patient. We're going to go up. Okay, what are we going to do? We all know we get vital signs. So let's say we get our vital signs and they're normal, okay? Doesn't give us any information. Physical exam, looks normal. Okay, we got some info. Now what are we going to do? Hit them with the 4 S's. Sugar, stroke scale, sepsis, seizure. Are they positive or negative? If they're positive, take action on that. If they're negative, go to the NOT, mnemonic. Overdose, O2, trauma. Now, this can be done by anybody. It's just an assessment. But I want to give you one tip for my medics out there watching this live cast right now. One more thing. What's one thing that we didn't talk about yet? EKG and electrolytes, okay? So one thing that we know causes altered mental status is electrolytes. And as a medic, I'm not able in the field, okay, under most common 911 situations, okay, be out there drawing blood and getting numbers back, okay? But what it can do everywhere and around the world is do an EKG and see if they're, for example, maybe hyperkalemia, for example. I can do an EKG and see if something else is going on that's causing them to be altered. So after we do that, just don't forget, it could be electrolytes. Okay, so I'll put electro, or it could be EKG issue. Now at that point, let's say it's normal sinus. We're not thinking about a dehydration or any sort of electrolyte issue. What are we going to do? Well, like we're all going to do. We're going to transport our patient, ALS routine, and go to the hospital and continue to reassess. But this is what makes you into a critical thinking medic and gives you a pathway on how to think, okay? And then that evolves into your own thing. Eventually, you'll be so good, you'll do what I'm doing, and you'll evolve into your own sort of flow. This is mine. I give to you. Start with this, okay? So now I want to talk about, this mnemonic is my own, and this mnemonic here is for wheezing patients, okay? So when your patient wheezes, I want you to, don't do the alphabet, guys. It's not A, B, C. It's going to be AAC. So when your patient wheezes, don't think of the alphabet. It's not A, B, C. They're wheezing. It's AAC. So AAC is when you're wheezing, okay? So the first A is for asthma. Now, what is asthma? Asthma is so simple. All it is, we have our lung fields. Our bronchioles are like tubes in a tunnel, right? That's all it is. It's like tubes or a tunnel or a cave, okay? If you have a cave, it can get like really, really large and get really, really small. So our lung fields can get the same way, really, really large and really, really small. That's it, okay? So with asthma, they get really, really small, and they get extremely tight, which means you can't breathe as well, which is why we give you medications like albuterol, like epinephrine, that open up your lungs. And my medics, what does that act on? Your beta-2 receptor that opens up your lungs. Good. Now, the second A is anaphylaxis, okay? And we have COPD. So this is how I assess a respiratory patient. I'll go up to the patient. They're having a hard time breathing. What's the first thing I need to do at a respiratory call? What do you think it is? Put it in the comments down below. What do you think is the first thing that you got to do at a respiratory call? Put it in the comments down below. I'm going to give you guys a few seconds here, okay? What do you think? We're going to go over these two too. I'm just curious. Put it in the comments down below. Put it in the comments down below, okay? What do you think? What's the first thing you do? Put it down below. Now here it is, okay? Lung sounds. If I don't have lung sounds, I have no idea what's going on. And here's how I can prove it to you. Let's say your patient is a 55-year-old female patient, and she has a pulse oximetry of 92%. That's all the information you have. I know she needs oxygen. Okay. Is that gonna, but I don't know anything else. Are her lungs clear? Are they diminished? Is one side different than the other side? Is it rales? Is it wheezing? Is it rhonchi? I don't know. That's how we make all our judgment calls in EMS. So you got to have good lung sounds. So as I approach the patient, I will talk briefly and go right for lung sounds. Now, here it is. This is excuse me. This is your wheezing mnemonic. So if someone is wheezing, it's going to be one of these things, right? Now, in medic school, you might hear something called cardiac wheezes, okay? Which, you know, somebody might say, oh, like, what's that? You know, I'm not here to get your head scrambled. This is what I want you thinking about with a wheezing patient, okay? Now, if you're a medic, any patient with one of these things, you're going to end up doing an EKG on that patient. So you're not going to be tunnel visioned. You think critically. But when you're first starting out, you need to understand what wheezes. What makes the lung fields tight? This is what makes them tight, okay? Now remember, what makes anaphylaxis anaphylaxis? Two or more body systems makes anaphylaxis anaphylaxis. So if I just have hives, I don't have anaphylaxis. If I have hives and nausea, anaphylaxis. If I have hives, nausea, wheezing, stridor, now I have difficulty breathing. I'm sorry. You know, that accompanies difficulty breathing, then yes, I have anaphylaxis. It's two or more body systems. COPD is broken up into two main things. Only two main things for COPD. That's it. COPD is going to be chronic bronchitis or emphysema, okay? Chronic lasts a long time. Bronchitis, anything that ends in itis, is an inflammation or infection of the thing that we are talking about. So chronic bronchitis means your airways are just inflamed. That's chronically, all the time, okay? Now, emphysema is a problem with the alveoli, which is where our gas exchange, now think about it, where's oxygen going? In the body. Where's carbon dioxide going? Outside the body, right? What's the alveoli do? Help exchange that. What happens if your alveoli is messed up? You have emphysema. I think of emphysema like a puzzle. You ever see those little like child-sized puzzle pieces? There's like four blocks, maybe 6, 8 blocks. You got to fill it in. I think of emphysema as someone removing the blocks, and now there's holes in the puzzle, and it's all messed up. That's emphysema. Okay. So let's do the next one. Now, these two mnemonics are the exact mnemonics that got me through my paramedic ride time back in 2012, 2013. Got me through medic school. Here it is. I'm going to give it to you. Okay? Here it is. This got me through my precepting, my doctor ride. If you're out there right now, maybe you got to do a med control ride. This is the gold. Shout out to the man, John Belinsky Jr. These are the two greatest mnemonics here that I've ever seen in my career. Here they are. So the first one has to do with chest pain. And it is called, Who's Your Papa? So if you have chest pain, what you're going to do is you're going to say, who's your papa? P-A-P-P-A. Okay? That's a mnemonic. What this mnemonic does is it covers the 5 worst causes of chest pain that you cannot miss as an EMS provider. And by the way, EMTs, the basics that are watching, this is not over your head. I could teach anyone in the world to do this. The only difference between an EMT and a medic is the medic has more equipment. That's it. And can, legally do more. That's it. An EMT can do just as great assessment as the medic can. They both have brains. That's why we're here. Let's get smarter. Okay? Here we go. So we got PA. PPA. And I'm going to talk to you guys at the end. Make sure you stay till the end. I've got to share something with you very, very important and very powerful. If you're studying for your national registry exam or you're in the middle of school, I got to share some with you. You're going to want to stay to the end. It's going to be powerful. And I got to tell you about it, okay? So stay tuned. So who's your papa? The first P is pericarditis, okay? Okay. First P is pericarditis, okay? Now, what is that? Oh, itis again. What's that? Inflammation or infection of, we have, well, the heart. Well, not the whole heart, around the heart. Wait, didn't I say something about the pericardium in school? Wasn't it like the outside of the heart? Oh, yeah, that's it. See? Pericarditis. Your pericardium is inflamed or infected. That's all it is, my friends. That's all it is, my friends. So what is that going to do with the heart? Do you think it's going to pump as well? No, of course not. There's an infection around the heart. Not going to pump as well. Not going to be as effective as it usually is. So that's the first thing we're going to look for. Hey, medics, how do we find pericarditis? Well, on EKG. There's two things in the EKG of pericarditis. Your number one, actually, I'm going to make it three. I'm going to give you a bonus, okay? So here's the bonus first. It makes sense to maybe if you're a little newer in class. With pericarditis, there's no reciprocal changes. There's no 2 up and 2 down like a STEMI, okay? So when you have acute coronary syndrome, when you have a heart attack, you get 2 up and 2 down. So 2 elevated that are friends, contiguous leads. I have plenty of videos on this on my channel, okay, if you want to check it out. And also you have 2 down, like 2 ST depressions of 2 other friends, 2 other contiguous leads somewhere on the EKG. Now, with pericarditis, you don't get that, number one. Number two, please remember this. Please remember this, guys. When you do an EKG, you always look at, when you're doing your ST segment elevation or depression, you never ever, don't do it, please, because you will miss this. You never ever go off the PR segment or the PR interval. You go off of the isoelectric line between the T and the P. That's your isoelectric line. That is what you go off of when you're measuring your ST segment, okay? Whether you're elevated or depressed or normal, okay? Why? Pericarditis has PR depression. The other thing about pericarditis is its elevation that doesn't make sense. So it's ST elevation everywhere, but there's no depression. It doesn't change or get worse. And it's all over the place. It's not like 1 in AVL, 2, 3 AVF. It's like all over the place. Like, wait, how is 1 up and 2's up? And it's all over the place, okay? That is pericarditis, okay? So now you have that stamped into your head, stamp it in your head, and that's how you do it, okay? Now, next is ACS. So what is ACS? Sorry, let me erase that, guys. So ACS is acute coronary syndrome. Acute means it's happening like right now, like okay, very fast. Coronary, well, we know the coronary arteries in the heart, so we're talking about the heart syndrome. Acute coronary syndrome. The coronary artery is being blocked acutely. Watch out, okay? That's all it is, okay? So ACS, it's basically part of ACS. What we're looking at here is a STEMI. That's why we're paramedics, guys. The whole reason that we have this right here, the life packs, is for 12 leads. That's the whole reason we have it, to save people's lives with a 12-lead EKG. That's the whole reason. So we got to know this stuff. So if your patient has a STEMI, okay, we can't miss that. 2 up, 2 down. Big thing about STEMIs, they get worse. Remember, STEMIs start off with those hyperacute T waves. Then you get a little elevation. Then you get 2 up and 2 down, okay? Next is going to be pneumothorax. But what I really want you to look out here for is tension pneumothorax, obviously. So I'm just going to put pneumo. Here we have PE, and down here we have an aneurysm. Okay? Okay? So I'm going to back the board up for 2 seconds. Back it up. Okay, now I just want to just talk about these last three. So when we're talking about pneumothorax, tension pneumothorax, the main things to watch out for, and it's the way that I teach it, and I'm going to stand over here so you can see me, okay? If I get shot with a bullet right here on the right side of my chest, bam, I have an open pneumothorax, right? Right. I have a chest wound, okay? Now, here's what happens. It's pretty crazy, okay? This is what actually happens. The hole here gets so great that air literally goes, this is great. I'm going to go right in here and cause all this pressure. But we normally breathe from here and here. But it wants to go in here. So if I put a three-sided dressing here, I allow it to escape instead of rush in. And we are now trending towards going back to normal. But we're not out of the woods yet. Okay? So if we have pressure on this side and our lung is collapsing and air is coming in, okay, through here, I'm going to put pressure. The mediastinum is the middle. Media, the middle. Okay, it sounds like it. Okay, works good. Mediastinum is a space right here where the heart's right here. Okay, right here. So what's going to happen now? Pressure is going to go and place on that heart. You know what's funny? CHF, when the heart fails, gives you JVD. You know what's funny? Cardiac tamponade can give you JVD. You know what's funny? Tension pneumothorax can give you JVD. Why is that? I'm putting pressure on the heart and I'm making it fail. Just heart failure. Feel me? Okay? So JVD, a late sign is trachea deviates, moves a little bit. Because we're shifting everything over. Our medics know about needle decompression. Okay? Now, pulmonary embolism is very simple. And actually, one more thing about tension pneumos. Remember your lung sounds, guys, for tension pneumo? Once, obviously, if I get shot here, then we're going to have one side doesn't sound so good. The other side's going to sound more clear. Eventually, it's going to shift. Okay? Now, pulmonary embolism. Pulmonary embolism is very simple. Most of the time, it stems from a DVT down here in the leg. So if I have veins down in my calf, and let's say I have a clot and the clot travels, and the clot travels, it's going to go up my venous system. So if I have a deep vein in my leg and the clot breaks off and it travels up the venous system, where is it going to end up eventually? In the IVC, the inferior below. Okay, word inferior means below, superior is above. Okay, the inferior vena cava, which where does that leak into? The right atrium. Then where do we go? The right ventricle. Then where do we go? The pulmonary artery. Oh, that's what a pulmonary embolism is. A clot gets right in to the pulmonary artery. Now, here's what it is. And I've seen a lot of PEs, and I'll tell you about them. I know for a fact, okay, I've had a lot of cardiac arrests that patients have had pulmonary embolism at, and they've died. I also have seen and had as patients young people, 20s, 30s, 40s, that smoke a lot or have other risk factors, and they have a pulmonary embolism, and they're awake, but have chest pain, shortness of breath, and they're on heparin drip in the ER. How do we know what we get? Well, one, obviously, how much of the clot got dislodged and how far down it went. That determines, okay? So pulmonary embolism isn't always going to kill you, like right then and there, like you know, like a really bad clot could do a lot of damage like this, right? But sometimes things can be smaller. What vessels does it hit in the body? I'm talking about other clots. Do you get what I'm saying? So that's how it is with pulmonary embolism too. Okay. Aneurysm. This is very simple. Now the way that I was taught this is any pain from your hip to your neck, you should probably think about some sort of cardiac issue. Okay? What I'm trying to say here is don't neglect it. So that's where this is my own take on this, okay? This is my own take on this, okay? So if I have somebody, this is where I'm going, so hang with me, guys. You'll see where I'm going. Let's say you have a patient, abdominal pain, epigastric pain, chest pain, and they're very hypotensive. The first thing that goes to my brain is an aneurysm. First thing that goes to my brain is an aneurysm. So that's why it's there. You can't miss that. It's a life threat, okay? So now we're going to talk about is shortness of breath and the 5 things you cannot miss with shortness of breath patients. Again, shout out to the man, John Belinsky, for his mnemonic. And these are the mnemonics that literally got me through ride time back 2012, 2013, when I was riding around in the ambulance, and you know the doctor would say, "What do you think?" And here it is. Okay? Shortness of breath. So you go to a patient. I want everyone right now, if you're watching me, wherever you are around the world right now, and we have people from all over the world, I want you to visualize this right now. I want you to visualize a 48-year-old male patient in a 1-bedroom apartment all by himself. He's tripoding and has shortness of breath. What are you going to do? Well, you don't want to make a horrid mistake and miss something. You don't want to make a horrid mistake and have this 48-year-old male patient have a bad outcome. So we're going to hit him with horrid. Here it is. H-O-R-I-D. Okay? H stands for heart. So what I'm talking about here is don't have tunnel vision, okay? You don't have to have clear-cut chest pain to have a heart attack, okay? You can have all kinds of stuff. Back pain, abdominal pain, nausea, I'm just short of breath. Oh, I just, maybe they're only speaking in 1 or 2 word sentences, stuff like that, okay? The heart. There's one more thing with the heart, though. Our friend heart failure. So really what I want you to think about the heart is, could it be a STEMI? Could it be an MI? Could it be a heart attack? And also, is it CHF? How are we going to know these things? Well, lung sounds would be CHF. EKG, we could find a STEMI, right? JVD, edema in the legs, high blood pressure, CHF. Okay, that's how we find these things. Medical history. Do you have a history of heart failure? What meds is the patient on? Are they taking Lasix or Bumex? Okay. O is for obstruction. So is there something obstructing our airways? So think about this. It could be a foreign body. It could be an aspiration and aspiration. It could also be stridor as well. It could be anaphylaxis that's closing me up. Okay? R is for reactive. So reactive is AAC. Reactive is how I teach it, AAC. So reactive is, we already went over my AAC method. It's not, remember, if you gotta wheeze, think about the alphabet. It's not ABC, it's AAC. Come on now, okay? AAC, asthma, anaphylaxis, COPD. How do we check for these? Are they wheezing? No? Okay, probably not one of these. That's it. Okay? Eyes for infection. Now with COVID, I probably didn't have to say this, as you all know, But under normal times, yes, COVID, yes, pneumonia, yes, flu. What does that look like? I talked about pneumonia earlier. Green, yellow sputum. Could be productive or non-productive cough. Patients are going to be very weak. Could have some other, even I've seen sometimes even some GI, some nausea, and vomiting. They're sick patients. So we're getting at here. They're sick patients here. But you're looking for that sputum. And maybe you'll hear rhonchi. Pneumonia, you'll hear rales earlier. And then eventually you'll hear rhonchi, okay, with pneumonia. D is for death, okay? Death. So what does that mean? The two killers we talked about earlier, pulmonary embolism and pneumothorax. We can't miss these. So if we are EMT, advanced EMT, a paramedic around the world, we cannot miss this in our patients. So you're going to go up to your patients, and you're going to get lung sounds. And your lung sounds are going to start to put you in the right direction. Okay, hello, hey, my name is Evan. I'm a paramedic. What's going on today? Okay, I'm short of breath. All right, lean forward an inch. I'm going to listen to your lungs. Listen, listen. Move back, listen, listen. What do I get on my lung sounds? While you're doing that, don't sit there. You got a partner. Have your partner start to connect the patient to this. Okay? So then while you're doing that, which we know takes some time, roll the shirt up, listen, 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 listen. Get vitals. You have your monitor right here. Here it is. Get vitals. So by the time you're done doing the lung sounds, you have vitals. You look at the screen. Now I have my lung sounds, I have my vitals. What's next? My exam. Check my neck, check my chest, check. I already got my lung sounds. Most important. Vital signs, I already got a pulse ox. Now I can take in and say, okay, what's going on here? What haven't I done yet? An EKG. Coming up next. Now remember our patient was a 48-year-old male on the couch? I'm doing all of that right on the couch as soon as I walk in with the monitor. And that is being done, super quick. When you have a great partner, things get done. My friends, I hope you enjoyed this live cast tonight. I wanted to give you some of my best mnemonics that have helped me throughout my career. Guys, I really hope you enjoyed this live cast. I really hope you did. We're going to be doing a ton more of these live casts coming up. Like I said, Facebook, and if you see me live on Facebook, YouTube, I either got big announcements or I'm going to be doing some teaching lessons. If you see me live on Instagram or TikTok, I'm checking in, probably going to take some questions from you guys, stuff like that. Guys, make sure you're following me on all platforms. Now, I leave you guys with this, and here it is. If you enjoyed this talk tonight and you are not yet a member of the Paramedic Coach community, my program, my course, my friends, this is only a taste of what it's like inside the course. This is only this much of a taste of what it's like to be a member of the Paramedic Coach. I can tell you guys, my friends, I'm being completely honest with you guys. It's true. I have a folder on my computer. I couldn't even post the amount of testimonials that I've gotten with my program. And I don't say this to boast. I say this to let you know the power of the community and the power of the program. We're in the thousands. We're over, I think, 1,200 strong in our community group now, and we're growing and growing and growing. We are 10,000 strong on YouTube. We are 38,000 strong on TikTok, 5,000 strong, respectively, on Facebook and Instagram. This is the Paramedic Coach Army. And I didn't build this. We all built this army together. So here's what I ask of you tonight. Number one, if you're serious about EMS and you want to make sure that your school time, your exams, your national ranch read goes smooth and you pass, but not only pass, excel and become a great EMS provider that you always dreamed of, click the link right now in the chat. You'll see it above it. I'll put it in the chat. And I also have put it inside of the top. Prepareforems.com. You get access to over 160 videos, okay? Some are lengthy, about 20, 25 minutes. Some are right to the point, 2 minutes, 5 minutes. The course goes over a few main things, and I'll share it with you. Number one, prepares a student for EMT, advanced EMT, or paramedic school. Every provider has their own sections. The second person is someone who's in school. I go over all the core concepts, the main concepts that cause people to fail out of school. And the final thing I go over is national registry prep. That's what I'm known for, getting people to get through and pass national registry. And how do we do that? And this is what I want to talk about tonight. I got to get it off my chest to you. Here it is. My friends, this is so important. I hope you can hear me on this, please. If you're studying for national registry, just hear me on this. Please. This is so important. You do not get smarter. You do not get smarter as a provider, smarter, by doing practice questions alone. You get smarter by studying content. Doing practice questions, all you're doing is assessing where you are. Those questions on a practice test, they are completely different than what you're going to get at National Registry. You have no idea what you're going to get. So I don't want you to make this one mistake. I don't want you to just only use practice questions. Because if you do that, you haven't studied for your exam. You've just assessed where you are, so you haven't studied. And I see so many people, and guys, I wish you could be here in the, I call this the command post of the paramedic coach here, and see the students that come in and message me every single day. And this is what I've learned from going through with all these students and seeing what they came in with. Oh, I did practice questions, it didn't work. Oh, I did this book, it didn't work. And they go through the program, and then boom, they have a breakthrough, and they finally understand the core concepts. And all National Registry is trying to get you to understand is, are you competent or not? That's it. You've already passed EMT school. You've already passed advanced EMT school. You already passed paramedic school. By all rights, you're already done. You just have to understand the core content at the national level, and that's what I do for you. So if you want to join our army, our community, I always say this is not just a video course. You do get access to 160 videos. You do get access to me as your coach in the community group. You can ask me any question you want in our community group. You also get access to our Paramedic Coach Army of members, and we are growing every day. My friends, I have one goal, I have one mission, and one mission only, to help you. That's my goal. I go to bed every night. I think about you. How can I impact you? What video am I going to do? What live am I going to do? What PDF am I going to make for you? And by the way, if you're the real ones and you stayed right now, I got an announcement for you. I'm coming out with a free PDF, another free PDF. You may have seen the 30 days of quick tips that I've done. My 30 days of quick tips. You may have seen it that I've done on Facebook. I've posted in groups. I've posted on my page. I've posted in our Paramedic Coach community group. I did 30 days in a row of quick tips. I sat down on my phone for 30 days and put in tips just to help you guys out. And here's what I'm doing. I'm taking that 30 days of quick tips and I'm putting it into a pocket guide just for you guys. And I'm calling it 30 days of quick tips. It's going to be an online reference, basically a little PDF, a guide, if you will. And that really is some of my top tips. I'm going to put it into a little guide for you. So you can have it on your phone. You can look through it. You can share it with your classmates. Absolutely free. Absolutely free. Okay. I've gone through, I've taken it. It's being edited right now. and it's gonna be coming out in a few days. So that was a big announcement for tonight. Those of you that stay to the end, you're gonna see it soon. That free PDF guide, my 30 days of quick tips, and again, guys, join us. You get lifetime access. It's only $49 to join the Paramedic Coach Army. Join us. You'll be glad you did. Much love to all of you, and thank you so much, everybody here, really, for watching, for tuning in, for the kind words, for the shout outs, and let's have our dreams come true and become an EMT, advanced EMT, paramedic provider. Let's go. I'll see you next time. Cheers.